As the Thanksgiving holiday season approaches, coronavirus cases continue to surge in parts of the Midwest.
It is really disturbing now to see these very high numbers in both Minnesota and Wisconsin and other surrounding states for Minnesota as well as we move into the colder winter season.
Dr. Helen Streich is the president of Regina Medical Center in Hastings and River Falls Hospital in Wisconsin. She says it's concerning as area hospitals are seeing an uptick of COVID-19 patients requiring hospitalization.
This means we're in a very high community spread.
The Wisconsin Department of Health Services reported 11 new deaths Sunday, with a total number of COVID-19 fatalities reaching more than 2,300. The total number of confirmed cases statewide now at more than 267,000. In Minnesota, the Department of Health reported its highest daily record, with more than 5,900 additional COVID-19 cases with 31 new deaths.
We are heading towards a need to flatten a curve. We have to make sure that we have hospital capacity and can care for everyone.
Dr. Streich says there are concerns about more COVID-19 patients requiring hospitalization and ICU capacity across the state.
I think we only have to look up to Canada, who had their Thanksgiving holiday in the October 8th, and they're seeing a increase in community spread and hospitalizations from their experience now that they're a month out.
Now she's urging people to take precautions to prevent the potential for a second wave.
We have a high number of cases at Thanksgiving. That means our Christmas is really at risk for high hospitalizations and maybe even higher deaths.
In Minneapolis, Charmaine Nero, KARE 11 News.